Ankle sprains are a common and disabling problem with potential long-term complications. There are also socio-economic implications for individuals, employees, and the health system. My name is Ludger Gerdesmeyer. I am the first author and will now present a summary of our paper on behalf of my co-authors. Treatments for acute ankle sprains include rest, ice, compression, and elevation, commonly referred to as RICE, together with oral analgesics such as paracetamol or NSAIDs. Topical NSAIDs applied over the site of injury are widely used, notable diclofenac. Robust evidence as to the effectiveness of these measures are generally lacking.
TR14 is a multi-component natural product with inflammation resolution properties. It is available as Traumeel or Traumeel, depending on the country of registration. This trial thought to investigate whether topical TR14 gel provided better early pain control compared to a placebo gel in patients following an acute grade 1 or 2 ankle sprain, and whether TR14 was non-inferior to diclofenac gel. Other areas of interest included examining the effects of TR14 gel, placebo gel, and diclofenac gel on ankle function, time to 50% pain improvement, intake of rescue medication, and safety.
This was a multi-center, double-blind, three-arm, active and placebo-controlled confirmatory trial.
The trial was registered at the European Union Drug Regulation Authority's Clinical Trials Database. The protocol was developed under the guidance from the German Federal Institute for Drugs and Medical Devices, or BfArM for short. Progress was regularly monitored by the sponsor, the CRO, and the statistical vendor performing risk-based monitoring. The main inclusion criteria were patient 18 years or older, having suffered a painful acute unilateral grade 1 or grade 2 sprain of the lateral ankle, 24 hours or less before first treatment. Among the exclusion criteria were bilateral injuries, a grade 3 injury, and injury affecting the same ankle 6 months or less previously. Following an acute ankle sprain, patients were randomized to TR14 gel, placebo gel, or 1% diclofenac gel using a random permuted block scheme in a ratio of 2 to 1 to 1. Treatment was applied 3 grams 3 times per day for 7 days, with follow-up a further 7 days. Review was on day 2, day 4, day 7, and day 14. Standard dose paracetamol rescue medication up to a maximum 4 tablets or 2,000 micrograms per day was available to all patients. Other pain relief medications was prohibited. Primary outcomes were to demonstrate the superior efficacy of TR14 gel compared to placebo gel on pain with passive movement assessed using a visual analog scale pain score, calculated as an area under the curve from baseline to day 4 and 7, and to assess the non-inferiority of TR14 gel versus diclofenac gel at the same time points. Other objectives were to assess pain on passive movement, changes in pain at rest, degree of patient activity using the foot and ankle ability measure activities on daily living subscale, requirement for rescue medication, and safety of TR14 during the whole trial.
The trial was conducted between 26th of February 2018 and 18th of November 2020 at 28 German centers. 625 patients were randomized. The full analysis set comprised 622 patients. Baseline characteristics are shown in this figure. The three treatment groups were considered well comparable.
The trial reached all primary outcomes. We found that TR14 gel was significantly more effective in reducing pain after 4 days than placebo gel. The medians for absolute VAS values for TR14 and placebo were 45.0 and 54.0 respectively. Similarly, we found that TR14 gel was significantly more effective after 7 days treatment with respective median values of 22.0 and 40.0. Comparing TR14 versus diclofenac, we found that TR14 gel was non-inferior to diclofenac gel in reducing pain after 4 days. The medians for absolute VAS values on day 4 for TR14 and diclofenac were 45.0 and 50.0 respectively. By comparison, after 7 days, we found that TR14 gel was both non-inferior and superior to diclofenac gel. The median values for TR14 and diclofenac were 22.0 and 33.0 respectively. Across the duration of the trial, multivariate measurements analysis, with the covariate being pain at baseline on a visual analog scale, demonstrated TR14 gel to be superior to placebo gel at all time points. In comparison to diclofenac gel, TR14 gel was found to be non-inferior at day 4 but superior at day 7 and day 14. Regarding pain at rest, TR14 gel significantly improved absolute pain score during the trial compared to placebo gel, except on day 2. In comparison to diclofenac, TR14 was non-inferior except on day 7, when it was found to be superior to diclofenac. The analysis of the foot and ankle ability measure activity of daily living subscale showed TR14 to be statistically superior to placebo and non-inferior to diclofenac at all visits. Time to improvement of pain on passive movement, defined as a 50% decrease, was shortened following TR14 treatment by 1 day as compared to both placebo and diclofenac. Regarding rescue medication, less than 15% took paracetamol at any point, and there were no group differences, which might have influenced the validity of the pain measurements. Adverse events were uncommon and mild across all groups. No fatal adverse events occurred on this trial. One patient in the diclofenac group suffered a serious adverse event, which was an unrelated spontaneous fracture of the humerus. We conclude that TR14 gel is beneficial and safe for the early treatment of patients with acute ankle sprains. It is superior to placebo and may result in faster pain resolution compared to diclofenac.